Hey everyone, this is Dr. Jad, and today we're going over the MRCP PACES Neurology Station. Watch this video till the end to get all the tips that allowed me to pass with just 11 days practice. We're going to be taking the tips from the first video in this series and applying them to the Neurology Station. Before we continue, a quick disclaimer. I don't recommend leaving your exam preparation for the last 2 weeks. I just wasn't given a choice as I'd been put on the waiting list and I didn't think I would be given a slot. Now that's out of the way, here are my top tips. 1. Identify the most common stations. This is a really important first step. Once you identify the most common stations, you can prioritize your studying. Let's take a look here. 10 conditions account for over 75% of neurology cases. These conditions are peripheral neuropathy, Parkinson's disease, Charcot-Marie-Tooth disease, abnormal gait, spastic paraparesis, cerebellar syndrome, myotonic dystrophy, myasthenia gravis, post-polio syndrome, and acromegaly. So if you learn these 10 conditions inside out, you're really stacking the odds in your favor. Of course, you want to study as many conditions well as you can, but it's great to be able to maximize your chance of success like this. Now that you know what to study, you also need to know how to study. This brings us on to number 2. Structure your studying. If you have a clear system, it will be much easier for you to recall crucial information during the exam, especially as you're going to be nervous. The structure I used was signs of disease, signs of severity, signs of etiology. This specific order lets you examine and present your cases in autopilot, as well as answer questions from the examiner effectively. So let's take peripheral neuropathy as an example. Signs include glove and stocking distribution of motor and/or sensory deficits. Signs of severity from the bedside include mobility aids, and on examination would include motor deficits pertaining to the MRC scale and how far up the limbs the sensory deficits persist. And the signs of etiology may include finger prick marks from blood sugar monitoring, indicating diabetic neuropathy, and chronic liver disease, indicating alcoholic neuropathy. These are only a few examples, but using this system will make remembering this information and getting into the right mindset so much easier. 3. The importance of a confident presentation. Remember, the examiner wants to know that you're competent, experienced, and a good communicator. I will give you an example of how to present a case, using peripheral neuropathy as an example. I examined this 30-year-old female who had distal, symmetrical, bilateral lower limb weakness and sensory loss in a stocking distribution. Tone was normal, reflexes were bilaterally absent with downgoing planters, and there were no cerebellar signs. Proprioception, vibration sense, and crude touch were also impaired up to the level of the knees. Gait was noticeably unsteady, and the patient had to keep her eyes on the floor to aid mobility. This is consistent with a diagnosis of peripheral neuropathy. The deficits were clearly severe and impacting mobility. Differentials include acute causes, such as Guillain-Barré syndrome, and chronic causes, such as diabetic and alcoholic neuropathy, although I would want to investigate fully for the wide differential diagnosis. This is a concise, well-structured presentation that paints a very clear clinical picture to the examiner, and this is what you will be expected to do on the day. There's no one way to do it, and the more studying and practice you do, the more comfortable you will become with your personal style. 4. Impress the examiner with knowledge beyond the curriculum. This will set you apart from the other candidates, although it's important to remember that you're not in direct competition with anybody. Just remember one fun fact per condition and you'll be fine. With Guillain-Barré syndrome, if you're confident, you could examine the extraocular muscles to rule out ophthalmoplegia, which is associated with one of its variants, Miller-Fisher syndrome. This is a simple trick that can get you extra marks. 5. Anticipate the examiner's questions. The examiner will ask you to present your findings, discuss initial investigations and treatment, so you already know what sort of questions to prepare for. But you can give leading answers to fill up some of the questioning time with topics you know about. For example, with peripheral neuropathy, when being asked to investigate, you can start by using your surgical sieve to name broad differentials such as autoimmune causes, metabolic causes, infectious causes, and causes related to malignancies. Your examiner would then likely ask you to elaborate, which you would find very easy to do, as you would know the underlying medical conditions already. Of course, it's important to remember that your examiner will probably have some questions that they're going to want to ask you regardless, so this isn't a completely foolproof system. 6. See signs. As important as practicing with hospital patients is, it's just not that efficient. We've all spent hours trying to see 1 or 2 patients. You'll never get the exposure to all the signs and pathology this way. By picking the right online revision resources, you can make your revision so much more efficient. The 2 online resources I used were PACES and Clinical Skills Pro. I personally think it's a good idea to use them both because the mixture of pathologies, presenting and questioning styles will make you dynamic enough to think on the spot and ace your exam. By not relying on one resource only, it makes you much better at thinking on the spot under exam pressure. I don't think I would have passed without using both PACES and Clinical Skills Pro, so I would recommend them both. Even though it costs more money to use both, you can use my discount codes in the description below to save money. And it's much cheaper than repeating the PACES exam, so I think it's a worthy investment. Now you know the secrets to acing your neurology station. I hope this was useful. Please like and subscribe so you don't miss out on any tips on how to pass your PACES. Feel free to ask any questions in the comments section, and see you in the next video.